That's excellent.
Oh, thank you.
Good blood pressure here.
That's what I wanted to hear.
Yeah.
It was worth coming in for.
Want me to write it down?
Thank you. Yeah, that would be good.
Hi, I'm Susan Cargula, and I'm the director of the Diabetes Self-Management Program and Community Wellness at Holy Cross Hospital. And we're here at the Holy Cross. I hope that everyone listening and seeing this has been to the health fair. The health fair has been in existence for 16 years. Holy Cross Hospital has been sponsoring this health fair. Many departments from the hospital participate in the health fair, and we also have a total of over 60 booths. Many vendors from the community offering all kinds of testing and screening, all for the purpose of informing you and educating you so that you can maintain your health. We offer free lab tests that includes cholesterol, free blood sugar testing, especially if you have diabetes in your family or have any of the risk factors for diabetes. It would be a great time to come in and get that lab test done. Those results are sent to you within 2 weeks. We have height and weight, blood pressure. The Lions Eye Van is here doing free eye testing. We have different clinics, massages, Taos Herb Company, nutritional counseling. I can't even remember all the booths, but over 60 booths offering all kinds of health tests and screening. And we really encourage everyone in Taos to come. It's a fun event. Bring your children. One of our departments, the medical records department, has a great fun booth for the kids. Our dietary department offers counseling on nutrition and also very healthy snacks. Our women's auxiliary is here every year manning the registration booth and helping people with maps and questions about the health fair. We offer wonderful door prizes from different organizations around the community. So it's a wonderful event, and it's our way, Holy Cross's way, of thanking the community for their wonderful support over all these years.
Right on here.
Number 9441.
We don't need that extra weight on there.
No.
No. Oh, goodness. And then once you're on there, just hold still. And there's going to be some things that are going to appear when those go away.
Attention healthcare guests. Adults are protected.
You're at 44.6. You can go ahead and step off. Would you use the clock on?
Selling CDs.
Oh, were you? What do you have CDs for?
Oh, for a bank? I would have deposits chair.
Oh, that kind of CDs.
Yeah, that's
Boring.
That's a lot, isn't it?
It's nice. Well, for someone your age, being female, 24 to 36% is good. Okay?
So I'm over.
So you're over. Well, it's going to be your nutrition, and then also you want to make sure that you're doing cardio, you know, going for a walk, stuff like that. But mostly what it's going to be is your nutrition, just cutting down on what you're eating.
I'll tell you what, I have a sweet tooth.
Yeah, that gets us in trouble, huh?
If I just stopped eating sugar, I would lose 10 pounds in a hurry.
Yes, you would.
I have to lose almost 30 pounds.
Almost 30 pounds.
Oh, for Lord's sake. I'll look peculiar if I get that skinny.
Well, we'll take you just like you are.
Oh, thank you.
I'll get her a new one.
Okay, Alan.
We're doing child photo ID kits. Basically, it's through the MILK program, which is called Managing Information on Lost Kids. Farmers has partnered with them. And what we do is we take a disc photo of them today, and the parents take that with them. And we order the home organizer disc, and on the disc is an area where you can enter the child's current information, their picture, their vital statistics and everything. If a child ends up missing, you press on this icon and it automatically notifies all the law enforcement agencies in the nation. 1,000 kids are reported missing every day in America, and the majority of those don't have the current height, weight, and in some cases the eye color. And so this program automatically reminds the parent every 6 months to update the information so that they have the current information. And pretty slick.
to give 5 feet from the bicyclist when
but people aren't
when
gonna-
passing.
They're not going to be able to enforce that in this town.
Sorry?
About the display, could you tell me about that for a minute?
Yeah, this is various examples of what people can look for drugs. A lot of times parents particularly don't know what to look for. And so by showing people examples of what some of the things are that people might use to administer drugs, that way if parents see it or they can become a little more suspicious. And then of course this display is for just trying to educate people as the violence that happens in a DWI crash.
Thank you very much.
Sure.
What are you filming for, sir?
Sorry? Well, methadone. Not methadone. Methadone. Meth labs they talk about. It's not on there. Meth is actually...
I'm from the Public Health Department, and we are giving out information on preventive health, things like preventing skin cancer, and also on birth control methods and nutrition. We have the WIC program, immunizations for children.
Okay. We're a 24-hour, 7 days a week service, so if people have been poisoned or somebody thinks they've been poisoned, they can call the poison center, and when a lot of times we can treat them at home, they don't have to go to the emergency department. So we have pharmacists that answer the phones, and people can also call if they just have questions about chemicals or any type of poisons, bites and stings, snake bites, and we also have poison prevention information, so we provide that information as well. You're welcome.
Could you tell me what's happening at your house?
Sure. We're the Community Coalition for Promoting Protection from Secondhand Smoke. And it's called Clean Air Works in Taos County. So we're working with individuals and trying to help parents and grandparents know how important it is for smokers to go outside to smoke so that their family members aren't exposed to the smoke, because it's a cancer-causing substance. And then we're working with businesses and public places and restaurants to help them implement smoke-free policies, because people shouldn't have to go to work and breathe in poison. So if the workplaces are smoke-free, we'll all be healthier. So that's what we're doing.
So the grand prize will be announced in about 13 minutes.
Very good in Navy. Our men's uniforms are Navy. Oh, yeah.
What would you say to encourage me to volunteer?
Well, we have 9 other men. We have almost 100 members now.
What would I do as a volunteer?
Well, we have several things going on. We have a brand new gift shop that just opened, and the proceeds from that we buy things for the hospital and donate that money. We have the new surgery desk, the new surgery waiting room. We take care of that for the patients' families while the patients are in surgery, and handle all of that so they can not be too upset. We have positions of people that you never see. They help with paperwork back in surgery and in ER, and you never see them, but they work around. We have all kinds of positions. Absolutely no heavy lifting. And we don't discriminate at all. We have men, we have women, young and old.
You gotta watch what you do.
And we need more.
You never know who's watching you.
The hospital has doubled in size, and that's doubled our workload, so we're really looking for lots of help.
So it's a wonderful event, and it's our way, Holy Cross's way of thanking the community for their wonderful support over all these years. So thank you, and hope to see you at the next health fair.